and welcome back to my channel. I'm Rhea, your study buddy for hematology, and today we're going to cover malaria. So malaria is one of the oldest and deadliest diseases in human history, and we're going to cover the 4 types of malaria today, including the fevers that they cause, how they look like in the microscope, and how they get treated. So malaria is caused by the Plasmodium parasites. It's carried by the female Anopheles mosquito. When they bite you, the parasites go into your body and they infect RBCs. When they infect RBCs, that's when they cause havoc in your body. And it goes on to display a range of symptoms such as fever, chills, and even more severe complications if left untreated. There are 4 main Plasmodium species that infect malaria in humans. So the first species that I'm going to cover is Plasmodium falciparum. This specific species is the most dangerous species responsible for a majority of severe cases of malaria worldwide. It's common in sub-Saharan Africa and it's known to cause cerebral malaria, where malaria infects the brain. This is a life-threatening condition. P. falciparum causes irregular fevers that doesn't have a clear pattern, which separates it from the other types of malaria. So the second type of Plasmodium species I'm going to cover is Plasmodium vivax. Plasmodium vivax is the most widespread species of malaria that can be found in Southeast Asia and South America. It's less deadly than P. falciparum, however, it has a dormant form where it hides inside your liver as a hypnozoite form. The species can cause malaria fevers that spike every 48 hours. This is known as a tertian fever. The next type of Plasmodium species I'm going to cover is similar to Vivax. It's called Plasmodium ovale. Plasmodium ovale is relatively rare and shares similarities with the Vivax. This includes the ability to form dormant hypnozoites inside your liver, and it causes a tertian pattern fever as well. So it's every 48 hours there's a fever spike. The last type of Plasmodium species I'm going to cover is Plasmodium malariae. Plasmodium malariae is not as severe as Plasmodium falciparum, and it is less common, but it can cause chronic infections as well, lasting years if untreated. P. malariae causes a distinctive fever that gives off a fever spike every 72 hours, and this is known as a quartan fever. While it's less severe, prolonged infection from Plasmodium malariae can cause kidney damage. So let's do a quick recap of all the 4 types of Plasmodium species and the types of fever they produce. So P. falciparum does not have a clear fever pattern. Plasmodium vivax and Plasmodium ovale gives a tertian fever, which is every 48 hours fever spike. And lastly, Plasmodium malariae gives you a 72-hour fever spike. So every 72 hours, there's a fever spike. So what's the treatment for malaria? So malaria treatment depends on the species and severity and drug resistance of what the patient has. The first type of malaria, Plasmodium falciparum, is treated with ACTs, artemisinin-based combination therapies, ACTs. This is the gold standard for treating severe cases. Intravenous artesunate is used for life-threatening conditions. Plasmodium vivax and Plasmodium ovale is treated with chloroquine and ACTs as well. To prevent relapses, because this is the type of malaria that also can lay dormant inside your liver, there's another type of drug that's also administered, which is primaquine, or tafenoquine. This is used to eliminate the dormant parasites that live on your liver. So lastly, Plasmodium malariae. So Plasmodium malariae is treated with chloroquine. As there's no dormant form for Plasmodium malariae, the chloroquine itself is enough to eliminate the presence of the parasite inside your body. And as always, please consult your health provider for an accurate diagnosis and treatment of the disease. So the good news about malaria is that it's preventable using insecticide-treated bed nets, wearing protective clothing, and taking prophylactic medications in high-risk areas before you even visit them. Plus, there is a rollout of malaria vaccine, and this will be a game changer in regions hardest hit by the disease. Okay, let's go more in depth when reviewing the different types of malaria. And when I say more in depth, that means in a microscopic level. Okay, so on the CDC website, you will find that if you search for malaria, so at the very bottom, the bench aids. That's where I want you to be. And in there, you have different types of bench aids that can help you diagnose malaria. So let's start with falciparum. Okay, so Plasmodium falciparum. So microscopically, P. falciparum infections in red blood cells are in normal size. Typically, only rings and gametocytes are seen unless the blood sat before the smears were prepared. So remember that. Only rings and gametocytes are usually seen in peripheral blood. So in hematology, what we would usually see is just the ring form, because then we prepare a peripheral blood smear and these are the ring forms. So as you can see, there's like a ring inside the RBC and it's thin and it's delicate. And usually there's just one parasite per RBC, gametocyte. This is what stands out for P. falciparum for me is the banana. I call it the banana. So as you can see, there is gametocytes in here that have the banana form. That's how I call it. It looks like a banana with parasites inside. Trophozoites and schizonts, they don't usually show up on the peripheral blood, so I'm not going to be worried about those because in hematology, we usually just look at the peripheral blood. Okay, so that's P. falciparum. So remember that ring forms are usually seen and the gametocyte, which is the banana form. Let's jump into Plasmodium vivax. P. vivax infections, red blood cells can be normal to enlarged, so they get bigger when they get infected in size and may be distorted. Under optimal conditions, Schaffner's dots may be seen in gem-sustained slides. So forgive me for my pronunciation. English is my third language. As long as you understand what I'm trying to say, I guess I'm getting the point across. The ring forms are a lot more stretched out. They don't really have like the nice delicate ring as the falciparum has. So see, the ring forms are a lot more circular and very small. The vivax, it's stretched out and they're bigger. And the cells itself, as you can see, they're getting stretched out. Slight enlargement of the infected RBC. And look at that. Look at that. As you can see, the infected cells are largely bigger, or slightly bigger. I'm sorry, it's slightly bigger than the regular RBC that's not infected. Trophozoites show amoeboid cytoplasm, large chromatin dots, and have fine yellowish-brown pigment. Schaffner's dots may appear more fine in comparison to those seen in P. ovale. So see, it's kind of like, it's not as prominent. Like it's a lot more fine, but we'll see that more when we look at ovale. Let's go into Plasmodium ovale. So P. ovale infections, red blood cells can be normal or slightly enlarged, like the vivax, may be round or oval, and are sometimes fimbriated. Under optimal conditions, Schaffner's dots may be seen in gem-sustained slides. So as you can see, P. ovale rings have sturdy cytoplasm and large chromatin dots. There's multiple parasites in the RBC. As you can see, there's multiple ring forms, and that really doesn't happen with the other ones. And fimbriated means there's like ripping. As you can see around the cell, there's like ripping, fimbriated, which we didn't see with Plasmodium falciparum and vivax. P. ovale trophozoites have sturdy cytoplasm, large chromatin dots, and can be compact to slightly irregular. See, now at this point, you're just like, they all look the same. So that's what we have with P. ovale. And as you can see, it's a lot bigger than the regular RBC. As you can see, it's fimbriated. See how there's rough edges to it right here and right here? For vivax, it doesn't seem to have that fimbriation. Yep, they're just nice circular RBCs in trophozoite form. And I think that's one giveaway too for ovale and vivax. And also the presence of multiple infections per RBC, I don't see that in other ones as well. The last one is Plasmodium malariae. So Plasmodium malariae infections in red blood cells are normal or smaller than normal in size. So this one is going the opposite way as the vivax and ovale, as you can see right here. So this one's smaller than this one. This one's smaller than this one. So normal RBCs, abnormal, normal RBCs, infected RBCs. Okay, and the same as P. Vivax and Ovale, it doesn't have the banana form of Plasmodium. But Malariae has this form that I want to mention because it shows up in exams, and it's called the basket form. So bear with me, it doesn't look like an exact basket, but if you turn this over, I can't. Okay, I'm just gonna mark it. So this is the handle, right? This is the handle, and this is the bag. And if you turn it over, it looks like a basket. So there. So it has a basket form trophozoite, and it's unique to Plasmodium malariae. Once again, let's do a recap. Okay, Plasmodium falciparum has delicate ring forms and a banana-shaped gametocyte. Both forms you can probably see on the peripheral blood. Plasmodium vivax is the one with a looser looking ring form, and it is larger. The infected RBCs are larger than the uninfected RBCs. It also has Schuffner's dots, but in a finer texture compared to Ovale. Ovale has a more prominent Schuffner dot. Plasmodium ovale has the fimbriated RBCs, which is like the ripping, uneven looking borders of the RBCs. A larger RBC when it's infected compared to its neighbors. We have multiple ring forms in the RBC. And lastly, we have the ripping and the more prominent amount of Schuffner's dot. Plasmodium malariae, the unique thing about it is it has the basket form trophozoite. Okay, and that's it for today. I hope you learned some things about malaria and understood it better. If you like this kind of content, please do like and subscribe. And until the next one, bye.